Hello, everyone. My name is Lola Oguntade. Welcome again to Lola's Voice. And today we're going to be talking about something interesting. We're going to be talking about sexual responsible act. How can we have responsibly, right? How can we have sex responsibly? We now live in a world, in an interesting world, in a funny world. Why you go out there to do what you do? How can you be responsible about it? How can you take care of yourself? How can you ensure you're taking care of your partner, you're taking care of yourself, and just doing things in a more responsible way? There are diseases out there that can, that are communicable, right? That's the word.
Yes, that is the word.
Yeah. So, I've done my research and I have a guest with me today, an infectious disease physician. I was at a conference, I think it was 2 weeks or 3 weeks ago, and I was sitting down on the table with her and she was just talking about, patient education, client education, and she was talking about, she was so much passionate about it. And I'm like, you know what? I think you need to come and be a guest on Lola's Voice. And right there on there, I found a topic for her that I think would interest me and interest you, because infectious disease is broad. It's not only sexual things. There are different, diseases that are infectious and doesn't even have anything to do with sexual, right?
Correct.
All
Yes,
right.
correct.
So introduce yourself to the house.
Well, thank you for inviting me to Lola's Voice. I was very excited. So my name is Dr. Christine Okwesili. I'm an infectious disease physician. I'm also board certified in internal medicine. I met Lola, like she said, at a conference, the Health Leader Global Business Conference. Yes, exactly 3 weeks ago. And we had a great conversation, and, we started talking about responsible sexual behavior, and it came up, and she, thought this would be a great conversation for the community that she speaks to. And I agree. I think it's a great conversation for everybody. There's not enough healthy conversation about sex and diseases that you can acquire through sex and how to protect yourself. And so I thank you for bringing this topic to light, and I know we're going to have a great conversation.
I can't wait. So I'm curious, I've had conversation with someone, just talking. I talk to people a lot for some reason. I don't even know why. And they talk to me too. And, I've had situation where, people have told me they have would have thought like kissing is the least of, because you're exchanging fluids, but not many people would have thought they could contact something from kissing. But, I've had instances where, oh, I kissed this guy, my throat hurt, something is wrong with me, my mouth is swelling, this is, I'm like, okay, I don't know. I'm not a doctor.
Yeah.
But I want to talk about it. Is it possible to have an infection from just kissing someone? And is that treatable? Is that I'm dying, or is that, what does that look like?
Great question. So, kissing is usually the first, after you've met the guy and, you've talked to him. Obviously, kissing is one of those first things that people engage in that is considered a sexual type of behavior. And so, yes, there are diseases that you can acquire through kissing. The most common one, which would be in younger people, teenagers, college age students, would be infectious mononucleosis, which is essentially an EBV or CMV infection that people acquire from kissing. It's actually primarily from kissing because you're swapping saliva, and it does give you a sore throat. It can make you feel bad. You'll have big lymph nodes on the side. Some people, it makes them so sick they do end up in the hospital. And that condition usually lasts 7 to 10 days, and eventually it goes away on its own. You don't need any therapy. Other things, of course, the more common sexually transmitted diseases that you can get potentially through kissing depends on one would be gonorrhea and chlamydia. Of course, it's not primarily the way that people get it, but because more people are involving in oral sex, the person that you are kissing could have acquired gonorrhea, chlamydia from someone else and have that in their oropharynx is the word that we use, so their mouth and their throat, and that could be a communicable disease in that way. People can also acquire syphilis lesions in the mouth. Same thing from oral sex. Yes. Well, they could have acquired it from oral sex, and then if their wound is open, then or they have an active wound or active lesion, that's something that you can get. And of course, herpes is another condition that people acquire a lot from. There's herpes 1 and herpes 2. Herpes 1 is primarily oral, and I don't necessarily like to call that an STD, because some people do, STD meaning sexually transmitted disease, because some people do get herpes infections from, their grandmother, their mother, if they have it, some other person, they could have
Really?
gotten it in daycare. Yeah, it's just, when you're swapping saliva, that's something that you can acquire. And it doesn't necessarily mean you got it from being, out there in the world or in the streets. It's just something that you could have acquired from somebody else who had it, that you happen to share saliva with. But HSV2 is genital herpes. So yes, you acquired it through genital transmission, either at the act of sex or through oral sex.
Okay.
And then, of course, I always like to highlight that you cannot get HIV from kissing.
Okay.
You cannot get HIV from swapping saliva. And so that should not be a thought that comes to your mind.
Okay, so thank you for that. That's
Yes.
like a very broad answer. But when you were talking, I was thinking about something. So I'm still gonna go back to So I know, like, maybe you spoke about STD, and people, we know about the infection people can contact, like where they have intercourse. Like, we know the prevention, use condom, right? But how can people prevent? Because this thing is hard. All these things, you
I
calm
hear
down.
you.
They sound like big English to me.
It is.
So
And
how can we prevent? I don't know. How can we prevent? Is it prevent kissing disease or something?
No,
I don't know.
I know what you're saying, but it's not really. I mean, most people don't have active lesions, right? If they had herpes, you would see it on their mouth.
So it's
These
not even
things that
herpes
people-
now, but the
the
you
other
call,
stuff.
Like, three
Yes,
diseases
and
now.
unfortunately, they're not things that you can readily know and see when you're looking at the person, right? So that's why I always say you need to get tested. You need people to get tested. If you haven't seen the paperwork, if the paperwork doesn't have a date on it that is recent being 3 months, it is not valid. You need your partner, ideally, before you even get to that point of wanting to have any type of sexual feeling about that person, ask them to get tested. Tell them, I like you. I think we're going in the right direction. But before we engage in anything, I need to be sure that you don't have anything that I get that I don't want to have. Because you could acquire something that you can't give away. You can't, cure, like herpes, right? Herpes doesn't have a cure. We can control it, but we don't have a cure. So that might be something you acquired because you were too fast. You just wanted to go and kiss and, But yeah, so sometimes it's, again, good to get testing. Herpes 1 and 2, you can test for the antibodies. Same, syphilis, HIV, gonorrhea and chlamydia all have testing. You can test for gonorrhea and chlamydia in the mouth as well. So if that's specifically something you want, you ask your part or the person that you're trying to engage with to have an oral swab of gonorrhea and chlamydia, and it can be done.
So, I'm just not this your answer. It's just, it's making things. So I know, like, maybe HIV, you can buy something in the pharmacy and just do like a quick test, Is there anything like a quick test for saliva that,
No.
you people need to come up with something. You people need to.
You're right. I might become rich if I create that.
Yeah, you people need to come up with
you're
something.
right. I mean, there is no like rapid diagnostics.
they need
for
to be.
syphilis
This
or
my
gonorrhea, chlamydia.
This is my invention.
Yeah,
If you are
so
a researcher, please reach out to me.
For real. Let's figure that out.
If just from my mouth or from somebody's mouth, all these big things you call is possible, because I've seen it. I've seen people talk about it, and I'm sure you see it every day. So this thing is real. It's not just something that we're making up or something. So they have to be like a rapid test for it. Kissing is very
So possible, but not so. Things like gonorrhea, chlamydia, syphilis are more likely to be acquired through genital, genitals, swapping, I don't know, vaginal fluid, semen, stuff like that. Oral is less likely. Is it there? Can it be there? Absolutely. And again, this is just based on people's sexual practices. And so unfortunately, no, there is no rapid diagnostics for that.
Okay.
Which, we always want people to get tested. And I, as much as, that guy might not feel like he wants to get tested, if he's not getting tested, then nothing is going down. Like, that should be your energy. Your energy should be
energy.
If it's not that energy, then I think that that person is not for you. They could be hiding something, and you don't want to know after the fact, right? If it's too late, it's too late. So you don't want to be in that situation.
And sometimes it might not be they are hiding something. Some people don't just know what they carry,
And you're
because
right.
they don't go to the doctor, they don't go to
And
the
you're
dentist, they don't do, they don't care about these things, like the minor details and everything. So that's good. So that's just from the mouth. Hey, this is serious. So now, remember, we want to talk about responsible sexual
Yes.
health. So I think the first thing you said is get tested.
Yes.
And we're gonna go back to the main thing, the down there.
The cocoa.
Yes, we all know, like, okay, we've been told
Yeah.
condoms, right? That's like
Yes.
the biggest thing.
Yes.
But how else do you think? There are a lot of people that don't like it, that don't use it. I don't know. I'm gonna ask for data because I'm big on data, but I don't have that report. I think you might have it. So, do we think like the HIV, like the percentage of HIV we had in the previous year, is it reducing or is it increasing? What would you say is going on right now? Do you understand my question?
Yes,
know
I think
asked it
your
very-
question is almost, so the number, so because HIV can't be cured, right? The actual number of persons living with HIV is probably increasing every year, right? Because we're not removing anybody because nobody has been cured, right? But the statistics are about 85% of people know their status, right? They know that they do or they don't have HIV. And really we care about, do you know that you have HIV? About 85% of people who have HIV know that they have HIV.
Okay.
And so it's not 100% like you were saying. So some people don't know that they have HIV.
Okay. So my question, I think you didn't get my question, is
Yeah,
like, maybe
go
in
ahead.
2022, we have 100 people with HIV. In 2024, do we have 200 people with HIV, or do we have, I just want to know the statistics. Like, is it increasing? Because I would expect, because we're taking measures, we're using condoms, we are taking the medication, doing all sort of things.
Yes.
So they are taking all those measures. So are we still seeing an increase? So if there's an increase in the number, I'm going to go back like that. I'm like, that means people are not actually taking measures. But if it's like, I don't know the statistics. So I'm asking you, do you know the statistics? And
I can't tell you exact numbers, but yes, my point, so your question is are people transmitting HIV less, right? In 2024 or 2023, 2024 compared to years prior. I don't have the numbers, so I don't want to tell you yes or no for sure, but ideally, yes, right? More people know their status, more people are suppressed, like virally controlled, so that even though they have HIV, they're not transmitting HIV to other people. This is in the Western world, right? Granted, globally, there is probably an increased risk of HIV transmission still, because there are a lot of people in under or developing nations that don't have the kind of access that we have in Western world, in the United States, in the UK, and other parts of Europe. And so, especially in those places, probably in Nigeria, we have a rise. One, people are very scared of taking medicine, and two, there are people who have it and are not getting treated. And so that is what is really increasing the number. People failing to understand that U equals U, right? I've said this before in different platforms, but undetectable is untransmittable. So if that person with HIV is taking their medications, is undetectable, meaning we do the test and we can't find the virus, they cannot give HIV to another person, even if they had unprotected sex.
Oh,
so
really?
the goal,
So does that work for it? Like,
that does work. That is data driven. That is evidence-based medicine.
So when you take that medication you're supposed to take, like, so if you have a partner that is not HIV, this thing, then even if you have sex with them unprotected,
correct,
you're saying they cannot transfer HIV.
Correct. As long as they are taking their medicine religiously and that medication is working to keep their viral load undetectable, which undetectable is based on the test that you use, but undetectable is a very low viral load. There's not enough floating virus for them to give it to somebody else. And so if more people did what they were supposed to do and take their medicine, which is the goal of public health, the goal of public health is to have people who know their status, get on therapy so that they can be undetectable, and that will decrease transmission. And so, yes, if you happen to be somebody who has a partner that has HIV, or somebody you're interested in that has HIV. I have many disconcordant is the word that we use, people who are either, dating or married, that one person has HIV and the other person doesn't. And that doesn't, there are ways still that the person who does not have HIV can protect themselves by taking PrEP, right? That's another word, pre-exposure prophylaxis, that they can take to prevent themselves from getting HIV from their partner. But if their partner is doing the work in taking their medicine, you don't have to take the medicine because they're doing the work for you.
But both of you can do the work.
Or you can do it together, right? There's no harm in you taking PrEP but people have to understand that the medications for PrEP are the same medications for treatment. It's just not as many medications, not as many drugs.
Okay.
But the drugs are well tolerated in 2024. You're not going to get sick. Most people feel nothing. So I would highly advise that people, especially with HIV, HIV is a big fear in the world. But, you would not limit your partners if, you don't have to limit your partners just because somebody you're interested in, somebody you love could have HIV. And that doesn't mean you don't have to be with that person. It just means you have to take precautions and they have to take their medication.
Okay, thank you for that. I feel like your answer is always very, very broad and it's detailed. I like that. So, we keep talking about HIV. Is that the biggest infectious disease from sexual acts? Is that the most dangerous? I don't think it's even dangerous.
It's actually not the most common. Like, people more likely to get chlamydia or gonorrhea from an unprotected sexual act, but those are curable, right? We can cure gonorrhea, cure chlamydia, cure syphilis, but the thing we cannot cure, have not, figured out the cure yet, is HIV. And so that's why it's such a big public health issue, right?
Okay.
Because the end stage of HIV is AIDS, right? That is acquired immunodeficiency syndrome. And so those people who don't take care of their HIV, their immune system becomes immunocompromised and they end up getting other infections, very sick in the hospital. And that costs the healthcare system dollars, right? Even having the control of HIV medications on their own are expensive. And so it's not as simple as giving someone injections of penicillin for syphilis and it goes away. It's a lifelong treatment. And so the goal is really to limit new people getting infected. And obviously abstinence is the one thing you can do, but in a sexual world that we're living in, abstinence is not always feasible. And so in lieu of abstinence, you have to either get tested before you have any type of unprotected sex, or you use condoms, spermicide, female condoms. There are options if you don't want to use the traditional male condom, or you pull out. Obviously that's, again, a pregnancy method, but also potentially an STD protection method. But depending on the STD, right? If it's a lesion if it's something that's on the penis, right? Like syphilis or herpes, whatever goes in has gone in, right? But if it's, something that requires actual bodily fluids to be transferred, like HIV, hepatitis B, hepatitis C, those are also STDs that people forget about. There is no cure for hepatitis B. Hepatitis B is just controlled, same with similar medicines that we also use to treat HIV. Hepatitis C does have a cure now in 2024. There was been a cure for a few years now. But hepatitis B, no, there is not cure. There are a lot of people in the world who have hepatitis B through, this is another word I'm going to throw out, vertical transmission, meaning
what does that mean?
They are getting the disease from their mother, right? So their mom has hepatitis B or HIV, and the baby acquires it as they're passing through the passage, right?
So I don't know, I'm not up to date, but so you can be, I know there's a way you can be pregnant and prevent your baby from having HIV. Is that
the prevention is taking the medicine? So the prevention is the mother getting their viral load low enough. Usually that number is under 1,000 viral copies, so that there's no transmission to the baby.
So do you start taking the medication before the baby, or do you start taking the medication when you're pregnant?
Oh, you take it. So ideally, right, the person involved already knows they have HIV, is already taking the medication, and is virally suppressed the whole pregnancy. But that doesn't always happen like that. There are some people who find out they have HIV when they're pregnant. And so the goal is to try to control the virus before the points of major transmission, which is at the end of that third trimester, when the mom is going to deliver. And so that is really the goal, to get them on medicine whenever they find out. There are medicines you can safely take in pregnancy such that the baby will not get HIV. And there are the same medicines that exist for hepatitis B. So if you know you have hepatitis B and you have a actual viral replication going on, there are medications you can take in pregnancy so that you don't give your child hepatitis B. And these are things that are with you forever, right? Because they don't have cure right now. So prevention in public health is number one, right? Working in reverse is always harder than working up front.
Okay.
And so those are our goals.
Okay. You're loaded. You're loaded.
I try to be.
I love all your answers to the questions. So let's just, I know we're wrapping up. Responsible sexual act. We've not even. I think we are there.
I think we're there. I think that before these are all part of being responsible, having knowledge, knowing who you're with. And then we were talking about, we had raised this discussion on the side about, does your boo have a boo, right?
Exactly.
And you can never really know if your boo has a boo. Or maybe you do know. If you're in a polygamous, marriage, or a polygamous relationship, or a polyamorous relationship, these are new things that 2024 Gen Z are bringing to us. But, if you're in any of those situations, you have to, it's really not just the person that you are involved with. It's all the other people that they are involved with, because that person doesn't know what they have gotten elsewhere. And so, you as the responsible party needs to be protected. Even if you're married, if you suspect that, I'm going to say this because I feel this way, but I feel like a lot of African men in Africa, I'm going to use that for them, actually have a lot of side chicks. They have their wife and other people, and you don't know what they're doing with those other people. So you, as the responsible wife, should be testing yourself regularly. So if you acquire something, your husband, you can take care of it, because infertility happens with gonorrhea and chlamydia. It will scar your fallopian tubes, and you won't be able to get pregnant. And you'll be wondering, why.
Gonorrhea and
chlamydia.
Is that a female thing or is that a male thing?
Gonorrhea and chlamydia can happen in both men and women, but men have symptoms. They start to burn before women. Women can have gonorrhea and chlamydia for weeks, months. They won't even know. And at that point, the fallopian tubes so the uterus connected to the fallopian tubes have become so inflamed that they scar. And when eventually you get treatment, they've scarred. And so the egg that is released from the ovaries can't even get to the uterus, right? And so those are the problems.
Serious.
It is serious, and people are not taking it serious. And you don't know what you do in youth that affects you when you're ready to have kids. And so the sooner we, pass that information for people to get educated, the brighter their future could be, because you don't want to be someone wondering whether, if you do have infertility issues, are due to something that happened in your past. Right.
So, this is interesting. So you're saying if you've had like a gonorrhea, chlamydia, even like 10 years ago, and it can still, even though you said it's treatable.
Yes.
But it can still
if
cause
you
infertility.
Had pelvic inflammatory disease as a cause of gonorrhea and chlamydia infection, yes, it can after that inflammatory response, that infection has happened, it has caused damage already in some degree.
Whoa.
And so down the road, when the healing has happened, everything is hard. The tubes are blocked, right? That's the word they start to use. The scarring that has happened on the inside has blocked the tubes. So the ovary that's giving the egg cannot pass through to get to the uterus. And so then people have infertility. And so, these are things people have to really think about when you're in the streets. When you're young, you're going to the club, you're having a good time. It's not registering. You're going to the clinic every other week. Maybe, I've talked to you before about this. There are people who prostitute, and that's how they make their money. There are people who are strippers, and that's how they make their money. I have no judgment. Just protect yourself in the process.
Yeah, I was gonna say, a prostitute can they'll use condom, and they'll probably be safer than someone that the boo has a boo. So
I mean, they use condoms,
yeah.
or those are, because they're in that line of work, they get tested frequently.
Yeah, exactly.
And even there's this other thing called doxycycline PEP.
What does that mean?
Doxycycline post-exposure prophylaxis. So if you're somebody in that kind of line of work where you're doing prostitution, or you're a side chick and you're sleeping with multiple men, you have risk of exposure. And so doxycycline is an antibiotic that we use to treat syphilis, gonorrhea, chlamydia, right?
So you start taking it
So
proudly.
it's kind of like the morning after pill, right? The way people take Plan B to prevent pregnancy, you take it's 200 milligrams. So doxycycline usually comes as 100 milligram capsules. You take 2 of them within 72 hours of the unprotected sex to prevent or reduce your risk of having gonorrhea, chlamydia, and syphilis. It doesn't do HIV and hepatitis B and C, but at least those things that could put you at risk are taken care of. And those are cheap medicines. The doxycycline is not expensive.
Is it over the counter?
It's not over the counter. So you would need a prescription for that. But if you told your doctor that you were somebody who has high risk behavior, high risk behavior in our world is you have multiple sexual partners, you involve in prostitution, or some type of escort, or you're a man that has sex with men.
Okay.
Those are high risk kind of situations. So if you're any of those people, you should definitely be looking at things like PEP or PrEP to keep yourself protected against.
I think
these type of
that's
things.
interesting to know. I think that's really good.
Yeah.
So my question is funny, and I don't even know how to ask the question. But are there any infectious diseases that are not infectious? Like maybe not
that are not communicable. That somebody you can't give to somebody else. I don't think it's not
communicable. I think it's communicable, but it's not like gonorrhea. It's not chlamydia. It's not. I think mostly from like male to female.
I mean, that is a sexually transmitted disease.
Yes.
I
think it's from a female, but I can't remember the name. Maybe vaginosis.
Bacterial vaginosis. That is a great question.
Yeah.
Because a lot of people think that bacterial vaginosis is a sexually transmitted disease, and it is not.
So it is what?
So bacterial vaginosis is an osis, so it's not an itis. So vaginitis is inflammation.
I need to go to medical school. What's osis?
Vaginitis is itis is inflammation. So vaginitis is inflammation of the vagina. But things that are osis, we consider them to just be there, right? They're there. And they're not causing inflammation, but in this case, it's causing an infection, right? And for bacterial vaginosis, women get this vaginal discharge that smells. It smells like fish. It's a very pungent odor, right? And there are antibiotics you can take for it. It's caused by a bacteria called Gardnerella vaginalis, and so it's not. The cause is obviously not sexually transmitted disease as the ones we've mentioned, but because it causes such pungent odor and you have vaginal discharge, your husband or your partner might feel like it's they're not comfortable with that smell, and usually it's due to an imbalance of pH, right? You're not your vaginal flora, meaning the bacteria that normally sits in your vagina, is off. And so that particular bacteria is the one that kind of rises its head up. It overgrows everything else. And you get this vaginal discharge. So easily treatable, easily curable.
So can a partner affect the level of pH?
Yeah, I mean, so, some women after they're what can increase your risk of bacterial vaginosis? Semen, right? Periods. Having a period changes that pH. Semen will change that pH. I thought of douching. Some people douche, which is like putting water or fluid or whatever into their vagina to wash it. But people do this, and it does change the milieu or the flora, the temperature of your vagina. And so it allows things that, wouldn't normally overgrow. And it becomes a problem. And so it is treatable. You can treat it with antibiotics. Usually a course of metronidazole will clear that up. If you're somebody who has that as a recurring issue, then you might need longer courses. Other things like yeast infection people get after taking antibiotics, again, are not infectious to the partner, but they're in the vagina. That one is more clumpy, white type of discharge. Again, can be easily treated with either over-the-counter suppository like Monostat is what we have in America, Monostat, or you can take a fluconazole pill. Just one pill will take care of a vaginal yeast infection.
Okay.
And so, yes, I mean, another thing worth talking about that's not, I want to mention this is HPV, right? Have you heard of HPV, human papillomavirus? It is something, it's not sexually transmitted per se, but the more sexual partners you have, the more exposure you've had to HPV. And so HPV increases your risk for cancer, cervical cancer, right? Cervical cancer, anal cancer, if you're doing anal things, cervical cancer, anal cancer, and penile cancer. And now there's an increased risk of head and neck cancer because of our practices, right? HPV can cause you a throat cancer, a tongue cancer, because we're engaging in oral sex
With different people, or
so the more partners you have,
the more risk?
the more likely you have picked up a strain of HPV that can lead to cancer. Not all of them do. There is 16, 11, 18, 35, and some 50 somethings. There are a few. And that's why people get vaccinated, right? There's the vaccine called Gardasil, right? The Gardasil 9, I want to say, is the latest Gardasil that has a lot of strains of HPV that it protects you against. And they tell people, get your child. People don't like the fact that it's a child, right? They say vaccinate between age 9. 9 is the lowest
so you can prevent that.
So you can prevent it from happening, right?
That's
because
good
once
then.
people start engaging in sex, you can't really go back, right? And so what you've been exposed to, you've been exposed to. So they try to catch people before their sexual debut, before they start having sex.
Okay.
And so that's why they, in America, we are all fast. So they try to get people to get vaccinated sooner. And it's just to be safe. So definitely, it seems odd to have your 11-year-old vaccinated against something that could be sexually transmitted, but we don't know what people are doing. So try to get it done.
Okay, that's good. That's like even me, I've learned something. I just hope people at home too
I'm glad.
have learned something. So I guess my final question to you is going to be, I know you've talked about getting tested. I think that's like the biggest, and is that the only thing people can do to prevent and have like responsible sexual acts? Is that, and we're not moral police. I'm not going to tell someone.
I'm definitely not a moral police. I think that, I think I'm not a moral police. I feel that people, we are having sex younger and younger, and there's nothing we can do about it. And so, how do you prevent that? How do you prevent, the main thing is preventing the bad outcomes of having sex. Sex, I think, is healthy for men and women. I think men are sexual beings and women are sexual beings, and they equally enjoy sex. And so as we get older, think about when a young boy starts to want to have sex, 13, 14. That is the same time a young girl wants to have sex, right? And so the sooner you start introducing these thoughts and ideas and teaching really to your child, or your sister or your cousin, because sometimes your mom might not want to tell you that, but as a sister or cousin, you might be, have more information to say, you're getting older. If a guy comes to you, make sure you protect yourself, right? Or if a guy comes to you and maybe you don't have mouth to tell them to get tested, at least try and get a condom or some type of spermicide, or even female condom, where the guy won't even see the condom because you are the woman is putting it inside of her. So he will never see the condom. He will never feel the difference, right?
Oh,
But
really?
you have prevented that from happening. And so I think it's education and knowledge. I feel like in our culture, we're afraid to talk about these type of things. And that's really what gets people in trouble, not only with STDs, but teen pregnancy, and a lot of things down the road. So we got to be more comfortable discussing these type of things.
Okay,
Yeah.
thank you
You're
very
welcome.
much. I feel like I still want you to say one last thing. So what's that one last thing I'm looking for? I don't know what it is, but I know there's something.
I mean, I think that, again, sex is healthy. Don't let anybody shame you that your body count is 100. That's their business. You know what I mean? I'm serious. I think that, men want virgins, but they don't want to be virgins, right? Which is not realistic, right? You obviously slept with other people's daughters, right? Before you got to that point. But think about it, right? You slept with other people's daughters, so you should expect that you might potentially marry somebody who is not a virgin. And so if we stop judging people, then people will feel more comfortable getting tested. People will feel, because you don't want to feel like that person does, oh, I'm going to the clinic the 5th time. The person, the nurse at the clinic is going to think I'm a shower or something like that. They will start labeling you with things that make you feel bad for going to get tested. Why? I think as we as a society get more comfortable.
So now we're gonna go back to we've done a lot of patient education, like you've said. So we're gonna go back to clinician education. Why should a nurse, start labeling people that you are not sure? So yeah,
I think
wanna
that
go back
people
to
have a lot of internal bias. As an infectious disease physician, and with the patients that I see, my biases stay in my house, right? Nothing comes out with me because, and even internally, you kind of have to remove that, because you can't be good at your job if you're looking at the person with judgmental eyes. You can't. Everybody is not you. You might not be accepting of what everyone does, but that's not for you to judge. The only judge of our lives is God, right? And it's not for you to judge. And so, I agree that as clinicians, we need to be more open-minded. We need to not pass along our biases or project our biases onto patients. And there's no reason, especially, in developing countries. I'm going to use Nigeria as an example because I'm Nigerian, but we have a tendency to say things to people that have nothing to, they're not our business. It's not your business. If somebody decides that this is the way they want to live their life, if that's not what you would do, that's not your problem. That's not for you to judge them. You should not be, nobody should be any other person's moral police. Unless you're God, you should not be anybody's moral police. We want you to be protected. I'm not advocating that everybody should just willy-nilly go and have sex, but if you find yourself in a situation, at least have the tools and resources and remove the fear and judgment that you feel you're going to get by going to the clinic, and that's really something. Like, I have patients that every 3 months I tell them, because I know them, I'm like, do you want to get tested? Let's do this testing. And I say 3 months. I didn't mention this before, but I think I mentioned the test lasts 3 months because people are out there, and then specifically we use 3 months because of HIV, because I can have sex with a partner today and I will not I won't know that I have HIV till 3 months from now, right? So there's a window period, which can be as long as 3 months before my test is positive. So just because somebody was negative today doesn't mean they're going to be negative at 90 days, right? And so it's worth, making sure that if this is even the new partner, you tested them today, and maybe 3 months later, there's some people have this 3-month rule, right? And you test them today, and maybe 3 months later you test them again, and make sure everything is okay before you dive into any type of sexual experiences with the person. And if that person is really for you, then they will be okay with that wait period of time. They won't die.
Okay. Thank you very much. Thank you.
And there's always masturbation, right? That's a topic for another day.
I don't know.
But yeah, that's a topic for another day. But again, that's part of the sexual health, and that's, people do that. And so, hey, if you don't want to be that person that's out and about willy-nilly, then you can do what you want to do.
Okay.
And again, I'm not promoting that, but it's always an option.
Okay, I hear you, doctor. Thank you very much. I felt like you've done justice to the topic. I'm taking away, testing regularly. I'm taking away prevention. I'm taking away all these diagnoses that you've made mention of. Even though I can't say their name, but I really educated myself, which is the goal, and just to educate other people as well out there. And get tested. Don't be ashamed. have sex, but have sex responsibly. I think
Agreed.
that's what we're going to take away from this space. Thank you very
Absolutely.
much.
You're welcome.
Thank you very much for sticking with us on this episode. I'm glad you've learned one or two things because I have learned a lot. A lot. And I feel like this is a topic that we all need. And, it's important to educate ourselves on everything we do, not just sex. So thank you to Dr. Christine. I think she did justice to the topic. And, thank you. If you like the video, please kindly like, share, comment. And if you have questions, please put your questions in the comment section. I'll put her Instagram and do tag her so she will come and answer you. You can see she's very passionate about the project. She's passionate about the topic. She's very knowledgeable. She's a doctor. So she knows what she's saying. I'm just here to learn myself. And thank you very much for watching Lola's Voice. See you next time.